Center of the UW School of Medicine and Public Health seeks to examine how a person's environment and social conditions impact their health right down to the molecular level.
The new research effort is called the UW Center for Health Disparities Research, or CHDR for short, and it launched in April.
And here to talk with us about it is Dr. Amy Kine, the Center Director and Professor of Medicine at UW. Dr. Kine, thanks for being with us today.
Hi, Dr. Kine. Good to see you.
Hello. It's great to see you, Eric and Susan. Thanks for inviting me.
Well, tell us about this. You really, the root of this is to study disparities, right? Tell us a little bit about what the whole research is surrounding.
Absolutely. Well, as you know, UW is deeply committed to advancing research to not only study disparities, but to eliminate disparities. And that really is the core construct of the center. And to do this, we need to understand why disparities happen, to get to the roots of their mechanisms. And this mechanistic focused type of research links cells to communities and neurons to neighborhoods, and it gives us new pathways towards potential therapies, precision medicine approaches, and different types of clinical and social interventions. So we're very excited that it's research truly targeted towards action, and we're really leading the way here at UW in this field.
So when you say neurons to neighborhoods, that's a good way to think about it. You're basically looking at all of the factors that you experience across the course of your lifetime and how they impact your health. Do I have that correct?
That's absolutely right. We know the places we live, the air we breathe, the social interactions that we have influence our brain, and it influences other cells in our body as well. But we can link the neighborhoods that you live in to the very structures of the brain. We can see changes in the tissue as a result of where someone's lived across their life course. And so this type of work is opening the door in completely new ways to truly understand why health disparities happen at a molecular level.
You started the Neighborhood Atlas. You developed that a few years ago. Tell us what that is and how this has really gotten a good response in the last few years.
Yes, the Neighborhood Atlas is a data democratization tool that allows anyone, not just the research community, but anybody in your listening area to take a look at the relative neighborhood disadvantage of the neighborhoods they live in or the neighborhoods they care about. It's at neighborhoodatlas.medicine.wisc.edu, and you can easily go in and map the neighborhoods of note. The reason it's been so impactful is we've had well over nearing 500,000 hits on the website, and many policymakers, researchers, and health systems are using the tool to understand the social needs of the populations that they care about and serve. Most recently, the tool has been used in a number of states across the country for COVID vaccine allocations to guide targeted outreach to neighborhoods in greatest need.
Wow. The center was recently awarded a $28.5 million grant. Congratulations, from the National Institutes of Health. And I understand you're going to be looking at Alzheimer's research. Tell us what you'll be doing.
Yes, we're so excited. This is such an innovative award. What we'll be doing is leading an effort that will involve 22 Alzheimer's disease research centers from across the country, from California to Massachusetts, but Wisconsin is leading the way. And we're working with these Alzheimer's centers to characterize not only the living participants that work with these centers, but also the participants who have died and donated their brains to science to help us find Alzheimer's cures, to characterize these individuals by their life course and where they've lived across their life course. It'll help us understand more about the different periods of the lifetimes that these individuals might have experienced neighborhood disadvantage or other social exposures, and whether there are certain windows of susceptibility in childhood or in midlife that increase risk for brain disease. Ultimately, we hope that this will form the foundation towards a whole host of new types of research that fall in the category of the social exposome. It's a kind of research that links these social factors to the very fundamental cellular processes in our bodies, and it opens doors for a whole host of new types of therapies. It's very exciting.
Incredibly important work, Dr. Kine. We also want to point out, Dr. Kine and Dr. Benlin, two women leading this. Very important to all those young ladies out there who want to be researchers. A great example.
Yeah.
Dr. Kine, thank you so much for your time.
Thank you so much, and we look forward to
much.
having you back to talk more about this at a later date.
I look forward to it too. Thank you so much for having me.
Thank you so much as well. Thanks for joining us.